Good morning, everyone. So nice to have you here. We are caffeinated and ready to chat this morning. So we are going to be talking about the psych clearance part of any surrogacy or egg donation process. So really excited. Today we have Megan and Sarah joining us. I'm going to have them tell us a little bit about themselves to get us started. So Megan, why don't you do just that? Can you tell us a little bit about your professional background as well as what you do at Family Source Consultants?
Absolutely. Well, like she said, my name is Megan. I have been with Family Source for almost a year now. Prior to that, I worked in various different social services roles, mostly as a licensed therapist, also working in foster care and adoption, so kind of helping build families from that perspective. So kind of have a lot of different pieces that have helped me in my work here at FSC, but now I work as the clinical mental health professional. I do psychological evaluations for our gestational carriers, egg donors, and for the intended parents as they prepare for their journeys.
Fantastic. And Sarah, can you tell us a little bit about your background and your role at Family Source? I'm sure it's actually very similar as far as what you're doing currently.
Of course, yeah. Thank you, Hannah. My name is Sarah Edwards. I am one of the other mental health professionals here at FSC. I'm here just about 6 months now. Prior to working here at FSC, again, similar to Megan in various phases of the mental health world, I've been in the field for about 15 years now, doing various things, starting out working in the crisis world and hospital settings, moving into some individual and group therapy, and then also kind of working on the provider side of things, helping with quality improvement and mental health improvement and advocacy and those sorts of things. So really a great precedent to come here to FSC to kind of switch gears a little bit and work with the intended parents and the surrogates and the egg donors to really make sure everybody is feeling great about moving forward on their journey. So thank you.
Fantastic. Well, again, thank you both so much for your time this morning. And for folks who are watching this live, we will be on for about the next 30 minutes live talking about site clearances. If you have any questions, thoughts, anything you'd like to throw in, just go ahead and put it in the chat and we'll be able to respond to those directly on the broadcast this morning. So feel free to jump in with anything. You just type it in the chat and we'll be able to handle that. So, and my name is Hannah. I am our communication specialist and I was actually a surrogate last year as well. So I have experience from that side of the house. I had to do a site clearance, but I have obviously very limited scope, which is why I'm so glad that we have our experts here today. So with that said, Sarah, can you talk to us a little bit about who does a site clearance? Like who needs to have this as part of their process? And at what point in their journey does the site clearance fit in?
Of course, yeah. So folks that need the site clearance in surrogacy, so that includes the gestational surrogate, the intended parents, and the egg donors. So generally, I'll start with the surrogates. So this is part of their process to get ready to go and get ready to match. So that will happen prior to being matched. They have all their intake process, and then we get to jump in and do the site clearance with them. So again, that happens prior to matching. With the intended parents, we also, some of the parents, we will go ahead and do the site clearance again throughout their journey, whether it's before they're matched, after they're matched, kind of just depends on the situation. Oftentimes, the intended parents, sometimes their clinics do that. So we don't do everybody for the intended parents, but we do jump on board when needed, and we're happy to complete those with the parents. We also do them with the egg donors as well throughout their journey to make sure, again, they're ready and willing and able to go through with their egg donation. So again, various times throughout their journey, but usually beginning-ish is when we try to get that completed. So we know that they are ready and committed and able to move through their journeys.
Yeah, the egg donor usually happens a little bit right before their medical clearance. So their matching process looks a little bit different than the gestational surrogate. So they have their match, and then that's prior in terms of getting ready for their medical screening appointment. We do that site clearance in that interim before they travel for med screening.
That makes sense.
Yeah.
I think it's important that it's all happening kind of before some of those dedicated pieces, though, like the travel or like signing contracts and things like that.
Absolutely. And I know you asked and who needs to participate in them. So from an egg donor perspective, it's just the egg donor herself. But when it comes to the gestational carriers, if they're partnered, their spouse or their live-in partner or whoever they're in a relationship with also participates in the mental health evaluation. So they're also screened in terms of looking at their ability to support the process and be a part of that journey from a therapeutic standpoint as well, and a supportive standpoint for the carrier, and being a part of that relationship with the intended parents. So they're also a part of that journey as well.
Now, are they done together in one sitting, or are they separate meetings with y'all?
Well, so for the gestational carrier, it is a two-part psychological evaluation. So we start with the PAI, which is the Personality Assessment Inventory, and that is probably the part that I think gives the most anxiety to our gestational carriers. They get nervous about this test that they have to take, and it is lengthy, it's long, and it asks a lot of questions, and it asks them in ways that could be confusing. And I think it gets people a little nervous and overthinking things. But that first part is only for the gestational carrier. Her partner does not have to participate in that piece. And then after the PAI assessment, we do a joint piece with the partner and the gestational carrier together. And that is just, a big conversation just with myself or Sarah, where we just go in depth and talk about their willingness and comfortability and support system, and just making sure that they're prepared for what is to come on the journey, and make sure that they're equipped with all of the necessary skills to handle all the different pieces of what a journey entails.
Yeah. And then Sarah, can you talk a little bit about why it's so important to know those things up front about the support system and things like that?
Of course. Yeah. I mean, entering a surrogacy journey, speaking to that end of it, is a huge commitment, right? It's not only a huge commitment for the surrogate herself, it's for her family as well. I mean, everybody is involved in this, right? Everyone kind of gets to go through this journey with her. So it's really important that we're able to assess whether, she is willing and motivated, has the right motivation to continue in doing this. As well as that she has the support. Again, it's a big commitment. There's a lot to it going on, and we want to make sure she's wrapped around through her family, friends, if she's partnered through her spouse or her partner. If she's not partnered, does she have, family, close friends, people that are there for her to support her through this journey, through the basic things like, hey, can you watch my kiddo when I go to appointment, to that, hey, I'm having a really bad day, I just need some support and able to, I don't feel great. It's the beginning of a pregnancy. We know how that goes. Sometimes that's not great. We want to make sure that she has that support. And we really want to ensure that the surrogates, if they're having some major life stressors or just your typical day-to-day stressors with kids, family, work, that they have the ability and emotional stability to be able to handle that, the coping skills, that they know, if I'm feeling this way, I need my own time out, or I need to go for a walk. We want to really go through those coping skills with them to make sure that they're able to transfer that into a surrogacy journey, and really make sure that they have the ability physically, emotionally, mentally, to be able to take this big step. It's a big thing, and we want to make sure that they're taken care of.
Yeah, so it sounds like it's just as much expectation setting on your end in some of these meetings as it is. I think some people go into the site clearance of like you said before, if this is a test and I'm kind of worried about it, but it sounds like it's more so in a lot of ways a conversation with expectations and making sure that, all the folks involved are knowing what they're getting into and supported in the right kind of way. Does that sound about right?
Yeah, I think it's just important for us to, of course, take care of the surrogates just as much it is to make sure the intended parents have what they need. So I think my mindset going into these assessments is, yes, I, of course, need to make sure that you are doing well and able to handle this in general, but also to have that conversation with you to make sure that, going into this, you're going to have the support of FSC on top of any support you have at home, to make sure that you are good to go forward.
Yeah. So then in addition to identifying a support network for the surrogate in these cases, what else are you looking for specifically when you're speaking with surrogates in the psych evaluation aspect?
Yeah, so we really look at, a lot of history. We look at their educational history, their occupational history, their financial stability. We look at psychiatric history, whether they've, had a history of any counseling services, psychotropic medication use, things like that. We talk about their pregnancy histories and how they, coped with their own pregnancies and their emotions during their own pregnancies. So it's a lot of looking back at their history and making sure that those align and that they've coped with that well, and they can transfer it, like Sarah said, transfer that to a surrogacy journey. And again, just like Sarah said, we look at that support system. We really look at, their commitment to the process. And I think, like you mentioned, it's a big psychoeducational piece, and making sure that we really give them, obviously up to this point, they've done their own research, and our surrogate intake team does a great job of educating them about the process, but just making sure we talk about what those bumps in the road can look like, and, going through some scenarios of, if this were to happen, what is your response to that? How do you typically communicate in stressful situations and things like that? So like you said, it's much less of a test. It's not a right or wrong answer. It's just a conversation and a making sure you're able to talk through these pieces and really, understand about what you're committing to, and feel comfortable with your ability to handle those bumps in the roads, or the twists and turns that come with every surrogacy journey. So.
Mm-hmm. So then does that change of what you're looking for when you're talking then with intended parents and then also egg donors?
Yeah, I mean, I'll speak a little bit to the egg donor piece. The egg donor evaluations are a little bit different in terms of, obviously, we still need to assess that they have a support system, that they're able to, commit to the process. The process is just a little shorter and a little different. So it's really looking a lot at genetic factors and, things that are inheritable. So when we look at history, we're going to look at more of their family line and history from a family perspective of their, parents, sisters, cousins, first blood relatives that might have anything that's inheritable or, passable to that embryo. So that's definitely a little bit of a difference that we see between an egg donor evaluation and a surrogate evaluation. And then when it comes to the intended parents, we're really looking to make sure, obviously, again, that they have the support that they need through this journey, whether that be, emotional support from outside of their, spouse or partner, through their family and things like that. But also we look at their ability to support the surrogate and maintain a level of respect in a relationship with them, and what that looks like to them, and what their hopes are for that, and making sure that, should those hopes not go the way that they want, that they still have the ability to provide some level of support and respect to that surrogate that's helping them through this journey.
I see, that's news to me. I think that's really helpful to be able to have that conversation with folks, especially because every surrogacy journey is very different. Every relationship between intended parents and surrogate is different, and that's okay. But that level of respect, I think, is so important on both ends at the end of the day. So I think that's really nice that that's being addressed kind of right off the bat. And again, this expectation settings, because people don't know what they're getting into until you're in it, really. So, so that's great. Now you'd mentioned something about like history with any diagnoses in the past or medications taken. So Sarah, do we have surrogates who have a history of anything mental health, or are all surrogates kind of expected to have clean slates? What does the spectrum look like there?
Right. No, that's a great question. And I think a lot of that comes in, there's still a stigma around anything when you whisper the word mental health, right? There's still that stigma out there. And I think it's important to know that, yes, of course, there are guidelines, that there are specific diagnoses that aren't going to be able to fly, right? We're talking, psychosis, we're talking major depressive disorder, significant anxiety disorders, things like that we would say, I don't think this is going to be a good fit for you, right? It just isn't going to work, because a lot of those diagnoses, you are going to be on medication, right? And again, nothing wrong with that. I know there's that stigma there, and that's okay, but it just might not be a good fit for surrogacy. But on the flip side, when we're talking, and I find it to be very important when I'm meeting with a surrogate and our partner or on our own, and we come to the questions like therapy history. Have you had any therapeutic services? And I can always see the hesitation. Generally, I might know ahead of time if she has this history. And I really try to make them feel comfortable. Be like, hey, I am a therapist. It's not a bad word. It's not a bad thing for you to tell me that you've been in therapy. I think it's important to see that, hey, I'm taking care of myself when I know that I'm not feeling great. So no, it's not you're out because you went to therapy. I mean, by my viewpoint, and I hope, and a lot of intended parents understand that, hey, if I'm seeking out therapy, if I'm having a hard time, a hard season, that shows my, inner strength to be able to tell someone when I need help and I need support. So with that being said, therapy, counseling, wonderful thing. Of course, you're going to get that from Megan and I. I mean, that's what we do. So we like to see people doing that. When it comes to medications for the surrogates and the egg donors, if there's a history, that's fine, but they do need to be weaned off of that medication in order to start a journey. And that's, again, something that we're going to assess. So if they come in and they're on medication and need to be weaned off, we are going to talk to them after that process is over to make sure that they're coping and they're doing okay being off the medication. So that's certainly a point that I want to make, that it's okay if you're on it, but the expectation is that you would likely get weaned off of that to begin the journey. And then we would follow up with you to make sure you're feeling good. And, without it, you're able to cope and move forward in that regard. So that's an idea to look for when you're coming in. Don't be scared to say yes.
Yeah. And I'm definitely of the belief that everyone could benefit from therapy. So I really like that, actually. But yes, I definitely hear you on the medication side of things, that it can be a little bit different. But I know that some folks have been a little nervous to even admit that they have been on medication in the past, especially if it was related to like postpartum depression or anxiety. Is that potentially, I know anything can potentially be a deal breaker, but is that potentially okay for them to continue if they've been on for postpartum related things?
It is possible to still move forward. Everything is such a case by case when it comes to something, as I don't want to say as serious as postpartum depression, but so directly related to what they're about to embark on. They're about to do a journey where they're going to be pregnant. They're going to deal with some level, and the risk factor is higher for postpartum depression. So to duplicate, in a subsequent pregnancy. So it's really just dependent upon how she coped. What if, medication is fine. Was she able to wean off? What do her coping skills look like since then? All of those different things, the support that we, have already discussed, what that looks like. There are some clinics that postpartum depression diagnosis will be a hard stop. But it isn't necessarily a hard stop for all of them. And it certainly is something that we're there to assess for when it comes to this evaluation. We want to have that conversation, and we don't want to discourage anybody from applying because of that. This is, again, a conversation, and we do our best to make sure that we can talk through those points and gather as much information in order to make sure that she is supported and that this is the best fit for her to move forward.
Mm-hmm. Yeah, I absolutely agree. And then you had mentioned before, Megan, that this is the first part of the screening is a bit lengthy. So what does that look like? How lengthy are we talking? What type of time commitment is this? Let's start with the surrogates, and then we can kind of switch over to intended parents and what they can expect.
Yeah. So the whole process, the PAI assessment, I typically tell surrogates takes about 45 minutes. Have I seen some go quicker than that? Absolutely. Have I seen some take much longer than that? Absolutely. It's over 300 questions. So I know when they first log on to the PAI assessment and they see how many questions they have to go, there's a little bit of a panic, like, oh my gosh, I'm going to be sitting here for hours. But once you get in the flow of understanding the format of the questions, it really starts to become a lot easier as you're going through. And then after the PAI assessment, we take the time, we review those results, and usually the second portion is scheduled at a later date. Sometimes we run them back to back, depending if the surrogate's partnered or not and what scheduling looks like. But then the clinical interview part, I'd say similar, about 45 minutes in terms of a conversation. Let's really, get into things. And again, some of those take a little longer, just depending how much there is to talk through and what the history looks like and things like that. So I think total time commitment, I'd plan on an hour and a half to 2 hours, depending on what it all looks like. And again, sometimes that's broken up into 2 portions. Sometimes it's run back to back. It really just depends on scheduling wise.
That seems very reasonable for this type of clearance. And it's all done virtually, is that right?
And it's all done virtually on Zoom. The PAI, I know some people get a little nervous again because we have to be there to witness that it's you taking the assessment. We have to verify that we're watching the correct person take the PAI assessment. Mm-hmm. So we're there watching, which seems a little odd to some people and catches them off guard at first. But really, we're just there to make sure, if you were to take it in person, you would be taking it in a supervised room anyway. So that's what that is us being in the supervised room to witness you taking that assessment. And then, the same thing with the clinical interview is all done via Zoom. So makes it nice and simple for everybody to be in one place at the same time.
Mm-hmm. And then the time commitment for the intended parents, what can they expect from the logistics of how it works?
Yeah, it's about the same. We don't have to do the PAI, so it's just the clinical interview part. So generally, same thing. 45 minutes or so depends on the conversation and how things flow. But same thing, and it's done via Zoom as well. We've had partners that are like, "Hey, one's at work. It's fine. You don't have to be in the same room." That's the great part of Zoom, that we can get that taken care of. On your schedule and on your timeline. We're happy to kind of adjust hours as we need to. If we need to see you later in the day, that's fine. We can usually make that happen. But yeah, same thing, about 45 minutes or so for the intended parents.
Great. So then for folks who are seeing their own counselor or therapist outside of the surrogacy journey, is that something that they can go to their own therapist about? Do they have to go through you all? Like, how does that work?
So the nice part about going through us is that it's, I know it's free of cost to the surrogate and to the egg donor. It's part of the pre-screening process. It's not going to cost you anything. I would imagine going to your own therapist is going to cost you some money. And also it's important that it be an impartial provider, somebody that you don't already have, this relationship built with, that can give a unbiased assessment of the situation. I'll give an example. Sometimes we have fertility clinics that require somebody from their preferred list of providers to do those assessments. And if that is the case with whatever clinic, the surrogate happens to be matching with, then that's a situation where you might be referred out to a different provider that the clinic requests or suggests. So in that situation, you might be referred outside of FSC. But other than that, yeah, we do them here in-house, Sarah and I both. So.
Great. So what happens if it's kind of a worst case scenario and you don't pass that, either the first part of the evaluation or the clinical meeting? Like, what does that look like then from there?
Yeah, so for the PAI, it's a sense of, if it's valid or not, or if there's some diagnoses that come through that we're a little concerned about that just come through that. In general, especially if it's invalid, we will kind of just have a set of time where we need to take a breath, right? And be like, let's try it again, right? And see if there's life situations that have changed or something that's going on, give you kind of a break, and then be able to move forward to try that again. So we'll try, we'll work it through, and we'll be able to do that. And that's fine. But then, if we go through the clinical evaluation and there's some concerns, there will be a conversation. There won't just be a no more, right? We will have a conversation. Hey, this is what we found. This is what we talked about. And then we'll be able to move forward, either offering them some support outside of us, making sure that they're getting the care that they need, and either say, we'll put you in inactive for now, and we can revisit you in 3 months, 6 months, whatever it might be, and see how you're doing there.
Mm-hmm. I think that's so reassuring that, it's not just you get a test and then the results come back and you're like, oh, you're out. Sorry.
Yeah, right.
Well, the goal is to keep folks in the process, but also do so in a way that, best serves their needs and keeps everybody happy and healthy throughout. That sounds about right?
Yeah.
Perfect. So then what happens if you do pass? Like, what are the next steps along the surrogacy journey? I know you're kind of experts in your own step in the field, but then what happens after that?
Yeah, so once they are finished with their psychological evaluation, we get their report, back to the intake team, and they're ready for matching at that point. We're usually the last stop. Maybe we've done it simultaneously as they've reviewed their first profile, and they usually are moving forward towards accepting a profile and getting ready for match meetings by the time they're done with site clearance. So it's I think, a very exciting final step. It's something we get to kind of celebrate with them at the end of their, clinical interview, is how excited we are for them to be moving forward and getting to meet a potential family. And so that's really a fun part for us, I think, is getting to have that celebration with them as they get ready for their match meetings.
Yeah, you get to give them really the green light to really officially in. That's so exciting. Is there anything that folks can do to prepare before they go into either the first or second part of the site clearance? I
think it's really a lot about just take a breath. I think that's the biggest piece. It's just relax and know that, we're not here to, it's not like you said, it's not a test. It's not something that is intended to be scary. And I know it can feel daunting, but just really take a breath and come into it with an open mind, and be ready to have some maybe uncomfortable conversations, but just be ready to talk about these things and be honest and upfront with us. And it really just is, like I said, a conversation. And the test part, I think my biggest advice prior to going into the PAI is just to not overthink it. It's so easy to sit there and read the questions and feel like, oh, it's trying to trick me. And we're there on the call. You can always ask us questions as you're taking the assessment. Obviously, we can't tell you how to answer, but we can help you understand the question if you feel like it's been asked backwards and sideways and upside down, trying to confuse you in any way. So
yeah, and I think it's important, I often say, this is just a conversation between us right now, right? There's no pressure. We really are just here to get to know you, make sure you have, all your ducks in a row and that you're comfortable with moving forward. So I think it's important. And I think Megan and I do a great job of this, of going in with a supportive mindset and an open mind. And we just kind of asked, the same, come in here, open mind, be honest, be upfront with our conversation. And I think that's the best way to be able to move forward and be successful together.
Mm-hmm. Now, do you have, we do a few minutes left. I'm interested to hear a little bit more about kind of the impact of a surrogacy journey on both intended parents and surrogates throughout the journey. Like, what types of things should folks be preparing for in advance? What types of things should folks be, thinking about as they're going through the journey? How does it impact them psychologically in your experience?
I think the biggest piece is just the unknowns. I think the word journey gets so overused. I know I've had intended parents tell me before, I hate that word. And I tend to agree with them, but it really is the best description for what they're about to go through. It really is a journey, and there's just so many things that are outside of everybody's control that there's a lot of unknowns, and that piques a lot of anxiety for people. And I think that's just something from a psychological standpoint to just be aware of, even if you're not, typically an anxious person. I think just this lack of control and having to just go with, science is science, and all of this is going to unfold in the way that it unfolds. And I think that just piece of unknown is something that impacts everybody throughout the journey. And I think that's the biggest piece to just be prepared for, and make sure that support system you have is really strong, and who you want to lean on. And if you don't have, close family or friends that you feel comfortable talking to about this, like Sarah said, we're never going to say therapy is a bad thing. So I think it's important to, whether your support is your best friend or your mom or your sister or your therapist, I think it's important to know what that support system looks like for you going into the journey, just to make sure that you're prepared for the twists and the turns.
Yeah, and I have to kind of piggyback off that and agree with you, Megan, is that unknown is a big thing. A lot of people from either sides, from the surrogacy side or the intended parent side, it's giving up a lot of control, right? You don't really have all that control. And to be, well, in a sense, normalize that with each other. I know relationships are different between different intended parents and different surrogates. Some, hit it off right away, and they just don't need us in the middle, right? They're just able to talk to each other and kind of talk through those, ups and downs of a journey like this, right? It's not always going to be great and exciting. It's going to be, like Megan said, there's going to be moments of anxiety and stress, of course. I think it's important to be able to normalize through that and also get the support, whether it's, surrogates reaching out to all the surrogacy support groups and Facebook groups and things like that. So they have that sense of, this is normal. You're not alone. You've got support of us. We're going to hold your hand and walk you through this. And the flip side, intended parents as well. I mean, their whole side of it is different too. They're experiencing different highs and lows, different anxieties that I think is important for them to also be able to relate to other intended parents that have gone through this and understand exactly what they're going through and are able to support and hold their hands throughout the journey as well. So I think that's important aspect too.
I think that's an important piece too about the relationship and how you're kind of in it with your surrogate and intended parents. Like, everybody's in it together. I know when I was matching, one thing that I was looking for specifically was a sense of humor in my intended parents, and kind of matching on that, which sounds so arbitrary and kind of silly, I know, but that was such an important coping mechanism for me just in general as a person. And so if that's important to you, knowing that finding a match based on that, for me, helped me tremendously psychologically throughout the process. Obviously, there's some stuff that you can't laugh at necessarily that gets very serious and stress inducing, but there's just so many kind of odd uncomfortable, weird types of moments throughout the journey that I think it's really important to be able to laugh about. So finding kind of what fits you personality wise and psychologically to make sure that you're kind of supported in that way by each other throughout the journey, I think can be really important. So I think that's a good point to bring up. And then finally, are there other aspects or advice that you have that we haven't shared yet as folks are going into or preparing for the site clearance, whether they be surrogates or intended parents or even egg donors?
I mean, I will say, I kind of mentioned it before, just come in with, honesty and clarity and just be ready to have a conversation. Also, Megan and I don't bite. We're very nice people. We make this pretty as comfortable as we can. We talk about some deep stuff, of course, some history and things like that we really got to tackle, but we do it in a way that it's conversational, and we're able to just kind of go back and forth and have that conversation in order for everyone to feel comfortable and be able to get, what we need on our end, but also you get the support and what you need on your end too. So I think that's important to point out.
Yeah, I like that you said that. We don't bite. We're not scary, and we do come into it. I like to think we, put people at ease and make them feel as comfortable as possible. And I think come into it, if you are nervous about it when you get on the phone call with us, tell us you're nervous. Like we're here to support. Really, that is our role. And obviously we're gonna go through all of the things we need to do to make sure you're prepared and that this is the right path for you as a surrogate or an egg donor or intended parents, all of those things. But we are here to support you as well. And we are always here to support you as the mental health providers at FSC. Like if there is any issues down the line, not just your site clearance, we are here to support. And that is one of our biggest goals here. So I think it's important to just recognize that we're here now, we're here later. We're here for everybody's support and definitely here to make you feel as comfortable as possible. So let us know, be upfront, tell us if you're nervous, that's okay.
And if folks are doing, so like, for example, we had an intended parent chime in the chat saying that they went through the fertility clinic for the site clearance, but they could still potentially use you all as resources throughout the journey then, is that right? Even if they didn't do the site clearance with you?
Absolutely. Yeah. Absolutely. We're always, obviously they have their case coordinators, but if they feel like there is something they need outside of their case coordinator, let them know, hey, like Megan and Sarah sounded great on that webinar. We would love to, connect with them just to talk through something, or like, we would just like to, see if they have any suggestions for outside resources or things like that. We're always here to support in whatever way we can with the intended parents, surrogates, egg donors, anybody.
Mm-hmm. Well, I do think you sounded great on this webinar. And again, I really appreciate your time. And I, think that our folks watching found this to be quite valuable, no matter where they are in the journey. I think there's kind of nuggets of information in there for everybody. So thank you both so much for your time. If other folks have, questions or thoughts or want to connect with either of you, I know that they can reach out via the website if they are not already connected with somebody at FSC. And we will be in touch soon. Thank you so much to both of you. Have a great rest of your day, everyone.
Thank you.